Good afternoon. Peter Thomas from Washington, D.C., NAAOP General Counsel. I wanted to bring people up to date on two main issues, the draft local coverage determination on lower limb prostheses and our efforts to try to figure out how the Veterans Administration can better accommodate amputees and people who use artificial limbs and orthotic braces. First, the draft LCD. There was a tremendous amount of activity during August and July. Many people who are members of NAAOP and all of the O&P organizations were incredible in responding to that draft LCD. As people well know, we received over 100,000 signatures on the White House website, a We the People website, or a petition that called on the President to rescind the LCD. There's about 2 more weeks left for the White House to respond to that petition. Because we got 100,000 signatures, the White House has obligated itself to respond. And we've been working with White House staff to educate them on the issue. We've also met with HHS in follow-up meetings. We've talked with a number of different people across the federal government, including in the Congress, and we're making progress. We're trying to figure out exactly what they're now doing with all those comments that they received, and we're actually asking them for a copy of those comments. They have not released publicly all of the comments that were made. Of course, the NAAOP is working in concert with the Orthotic and Prosthetic Alliance organizations in doing this. One alarming trend, or at least one development I should say, is the publication by United Healthcare of a policy that adopted the non-coverage decision that was embedded in the draft LCD for essentially vacuum sockets and that technology, even though there's very significant evidence that that technology is a real benefit to amputees in terms of volume control, volume management of their residual limb, and perspiration control as well. So we've written as an alliance to the United Healthcare and challenged that decision and intend on trying to meet with the medical director at the earliest opportunity. That's why we want the LCD rescinded, because if the longer it stays out there, with the lack of evidence that supports that LCD, the longer a lot of these very inconsistent and inappropriate coverage policies may be adopted by private payers. And so we continue to push for rescission of that policy. And we'll do all we can to do that very thing. On the Veterans Administration, we have been working with Congresswoman Elmer's office, who has introduced in the past the Veterans Administration, the VA Bill of Rights for injured and amputee veterans, and essentially trying to work directly with Secretary McDonald of the VA before introducing that legislation. A letter was drafted, signed by over 20 members of Congress to Secretary McDonald earlier this year, seeking asking him to implement many aspects of the VA Bill of Rights on his own authority. He has responded to that letter from Secretary Elmer's, and we are now looking at the letter in depth, examining what the letter says. It's fairly comprehensive, and we'll make some decisions in the near future as to how we proceed with that legislative effort and regulatory effort as well. The NAAOP will be meeting in San Antonio, along with many other practitioners and the O&P community as they assemble at the AOPA National Assembly, and we very much look forward to informing you of developments as they occur. The good news, I guess if you could say that, is that the federal government will not shut down, and the Congress was able to pass a bill that keeps the government open. So at least we don't have to deal with a shutdown government in addition to trying to address these very significant and vital concerns for the O&P community. Thanks so much.